Premalignant lesions of the tongue are conditions associated with an increased risk of progressing to squamous cell carcinoma, the most common malignancy of the tongue. These lesions often arise due to chronic irritation, lifestyle factors, or genetic predisposition. Common premalignant lesions include 1. Leukoplakia. Description: white patches or plaques on the mucosa that cannot be scraped off and have no other clinical or histopathological explanation. Risk: dysplastic leukoplakia carries a higher risk of malignant transformation, 5 to 20%. 2. Erythroplakia. Description: red, velvety patches on the mucosa with a high risk of harboring dysplasia or carcinoma in situ. Risk: malignant transformation rates are higher than leukoplakia, estimated at 20 to 50%. 3. Oral submucous fibrosis, OSMF. Description: a chronic condition characterized by fibrosis of the oral mucosa leading to stiffness and reduced mouth opening. Risk: strongly associated with areca nut and betel quid use, malignant transformation rate is 7 to 30%. 4. Actinic cheilitis. Description: premalignant condition of the lip, often due to chronic sun exposure. It can involve the anterior tongue through contiguous spread. Risk: progression to squamous cell carcinoma if untreated. 5. Lichen planus, erosive type. Description: chronic inflammatory condition that appears as lacy white striations, Wickham striae, or erosive lesions on the tongue. Risk: malignant transformation rate is about 1 to 2%. 6. Dysplasia. Description: microscopic alterations in the epithelial cells, classified as mild, moderate, or severe based on histology. Risk: severe dysplasia and carcinoma in situ have the highest malignant transformation potential. 7. Chronic hyperplastic candidiasis, candidal leukoplakia. Description: persistent white plaques due to candida infection that are unresponsive to antifungal treatment. Risk: increased risk of progression to carcinoma, especially in smokers. 8. Syphilitic glossitis. Description: atrophic chronic inflammation of the tongue associated with tertiary syphilis. Risk: rare, but recognized as a risk factor for malignancy. Key risk factors for premalignant lesions: tobacco, smoked or chewed, alcohol consumption, betel quid areca nut chewing, chronic trauma, e.g. sharp teeth, ill-fitting dentures, viral infections, e.g. HPV. Regular screening and biopsy of suspicious lesions are essential for early detection and management.